On behalf of the Area Agency on Aging of Pasco Pinellas, I welcome you to Aging on the Suncoast. The Medicare open enrollment, or annual election period, is a critical time for Medicare beneficiaries to review their Medicare coverage. To assist in this process, free, confidential, and objective counseling is available to Medicare beneficiaries, their caregivers, and family members through the SHINE program. For over 18 years, the Florida Department of Elder Affairs SHINE volunteer counselors have provided this essential counseling service, empowering Florida's older and disabled citizens to understand and to maximize their health care benefits. On today's program, we have two guests to tell us more about SHINE and to discuss Medicare. Jan Rauer is a volunteer SHINE trainer and special projects manager. Janet Mills is the SHINE area coordinator for Pasco and Pinellas counties. Welcome to Aging on the Suncoast. Thank you both for being with us today. We, of course, are very interested to learn more about Medicare and what SHINE counselors do. But let us start first by discussing some of the terms that we are hearing very frequently in the media and we will be discussing today. Janet, we're hearing the term Medicare Part D. Can you tell us what that is?
Yes, that is the Medicare drug plan that has been in existence since January of 2006. And every year during this time, between October 15th and December 7th this year, you will be able to review your current drug plan and enroll in a different drug plan if you wish to. And also drug plans can be attached to Medicare Advantage plans. But it is very good to review that information every year because the costs and the formularies that the companies carry change radically.
Okay, and this is the time of the year when those changes come out and people can make choices. And you've used the term Medicare Advantage Plan, or I've seen that acronym MAPD. Jan, tackle that one and tell us what a Medicare Advantage Plan is.
Okay. Medicare Advantage Plan is actually, most people would understand them if you said, do you have an HMO, do you have a PPO, do you have a PFFS? It's a alternative way to get your Medicare. Instead of using original Medicare Part A and Part B, that's combined together and usually includes a Part D. And it's presented to the citizens as a insurance program that they can decide to enroll in. And they would get all of their medical coverage as well as their Part D drug benefits, all under one umbrella.
Okay, so it's a managed care option.
Yes.
That takes the place of or connects with the Medicare system.
That's correct.
Okay, but we still have, for those who continue to have traditional Medicare Part A for their hospital coverage, Medicare Part B for their doctor type coverage, there is still the possibility to cover the copays and the deductibles through a Medicare supplement as opposed to an MAPD.
Right.
And what is that?
Original Medicare pays 80% of the contracted amount. So there is a 20% that is left uncovered, and also your hospitalization is left uncovered. So you can purchase a Medicare supplement. They're called Medigap policies or supplemental policies, and they are costly, but they do cover everything. In general, if you had a supplement in original Medicare, then you would have no further health care bills.
And you are not restricted to a certain group of providers.
Correct.
Which would be a distinction between a Medicare Advantage plan and a Medicare supplement.
Except they do not cover drugs. So you have to purchase a Part D drug plan.
In addition to?
In addition to your supplement.
Okay. And we started by discussing that this is the time of year when changes can be made. What types of changes can be made now, Jan?
Folks can choose a different drug plan if they want to.
Okay.
They can change to a different managed care program if they want to. If they already have original Medicare and they want to join a managed care program, they can.
Okay.
They can disenroll from a managed care program and go back to original Medicare. So there's several options that they can make. But they need to remember that if they decide they've been in a managed care program and they're going to go back to original Medicare and purchase a supplement policy or a Medigap policy, that they need to be sure that they've enrolled in the Medigap policy and they've received back from the company confirmation that yes, they are going to be covered.
Okay.
Because once you pass your initial enrollment time, when you can get a supplement policy, we sometimes forget that there is no guaranteed issue, meaning they just don't automatically send it to you because you're a nice person.
Okay, so they're going to look at your health condition.
Exactly.
If for a Medicare supplement.
Yes.
Is that true for a Medicare Advantage plan?
Only thing that they look at is if you have end-stage renal disease or kidney failure. So that if this is the case, then Medicare Advantage plans by federal rule do not take you. That's the way it works. Don't ask me how they come up with the rule, but that's the rule.
But otherwise, if you are not in
Other
that
than
situation, at this time of year, you can change. You can elect any Medicare Advantage plan.
Exactly, and nobody can refuse you coverage unless they're full.
Okay. And the dates have changed this year, Janet, haven't they?
Yes, they
That's an important message. If we leave nothing today, we need to get on the table the fact that the dates have changed. And what are those?
This year it is October 15th, which was last Saturday, and through December 7th. And as opposed to the November 15th through December 31st of last year.
Right.
So keep in mind, October 15th through December 7th for the annual enrollment this year.
Okay, so people who are watching the show today, if they haven't already started to give thought to this, to reviewing what they have, now is the moment, because you don't really want to wait until December 7th to make that change.
No.
You want to be ahead of the game. What happens after December 7th if someone is dissatisfied with their choice, they missed the date? Are there any options open?
The only option they have open is if they are in a Medicare Advantage plan, they have a managed care disenrollment time from January 1 to February 14th.
Okay.
But the only thing they can do at that time is disenroll from the managed care plan and go back to original Medicare, and they have the option of purchasing a Part D plan.
Okay.
So
until February 15th of next year.
February 14th.
14th of next year.
Yes.
Okay. What about, I've heard this term of 5-star plans. Where does that fit in? That's a new term this year, isn't it?
Yes, it is.
Okay.
Any managed care company who comes out with an approved 5-star plan, the person, any customer, any client, can choose to enroll in that 5-star plan if there's one available at any time during 2012. So that will be a special enrollment period. They can do this just one time.
Okay.
So if they are in a plan that's less than 4.5 stars, they can choose to join the 5-star plan at any time during 2012, just one time.
And do we have some of those types of plans in Pasco and Pinellas County, or is that information to be released yet?
That'll be released when the time comes.
Okay.
As far as I know, what's been released, no, there aren't any.
Okay.
At least on the Medicare.gov website, there's not any that's been released.
Okay. And bringing up the Medicare.gov website, we're going to run that telephone number throughout the show. That is an entry point to information if people want to can get on their computer and get to that site. What are some of the things that they might find there if they're looking at Medicare.gov that would be of help?
They can track their Medicare costs and billing for original Medicare. They can also look at all the Part D options, all the Medigap options, all the Medicare Advantage plan options online there for to do their own comparison, which is very helpful. It is a wonderful website. It has lots of other information too. What to do if you've lost your Medicare card, what to do if you need to appeal a bill from Medicare. It has a huge listing of resources that you can gain information from.
Excellent. So our viewers who are Medicare beneficiaries, they're faced with many decisions and many options right now. What are some of the things that they should sit down as they make their list to consider as they're making choices about whether the plan that they're in, they have some experience with that, hopefully. One, they, I assume, need to look to see if that plan's going to change next year, but then also to decide whether that's a good fit for them or whether something else is a good fit. What are some of the parameters there?
Okay, some of those parameters would be they need to see what is the cost if you go to see your primary care doctor. Is it the same as it was last year? Or is another plan offering a better price structure to see the same doctor? Because the first thing you have to do is ask your doctor's office, which plans do you participate in?
Okay.
So you put that on your list. These are the plans that my doctor participates in. Then you need to start looking at what the benefits are and what the co-pays are or the costs are. You know, what does it cost with Plan A to go to the hospital? Well, what is it if I'm in the hospital, I'm under Plan B? So you want to start comparing costs, because at the end of the list, you should be able to look at it and say, okay, the plan I have now, estimated cost is X number of dollars. And this plan over here, it's cheaper, it's Y dollars, and so on. As long as you're keeping track of these things, make sure all of your drugs are on the formulary. What are the problems that could exist on your Part D drug plan or your Part D with your Medigap plan? Is that is there quantity limits of the drugs that you take? Do you have to get prior authorization? Do you have to do step therapy? So you need to look at some of these things, because as you're comparing these plans and comparing the drug portion of it, you're going to see different things occur in each plan. So this plan may have wonderful drug benefits. All of your drugs are Tier 1 or Tier 2.
Meaning lesser copays.
Lesser copays.
Okay.
Well, in this plan over here, all those drugs may be Tier 2 and Tier 3 or 4. Meaning they may not even be on the formulary at all. So you're going to pay a much higher cost. So therefore, you know, people need to be looking at that. They sometimes forget. We get kind of in a rut and we say, oh, well, it was good enough last year, it's good enough this year. But if you are a good, wise shopper, then you're going to sit and check this out.
And my thought is two things could have changed. One, the plan itself could have changed, and two, your health needs may have changed.
Exactly.
As you have encountered perhaps a new health problem over the year. Perhaps hospitalization wasn't something you needed to consider before in terms of projected costs, but it might be in the future.
That's right.
Yes. Janet, you're working with a lot of people who are making these decisions. Do you have other items that you would suggest that they look at before they start to make comparisons? Or
I'll just talk about the supplements a little bit. Sometimes if you have huge medical bills or chronic diseases that you're dealing with, again, in the first 6 months of joining Medicare, you can get a supplemental or Medigap policy without reference to the state of your health. After that, they're going to underwrite you, but it can be money well spent, because once you pay that premium, you know basically that you're not going to have other expenses. So even though you may not have a huge income, for people that that do have huge medical expenses, it can be a good way to go.
You're basically paying more money up front
Right.
for more protection later.
And then as far as the Medicare Advantage plans, I think Jan coined a term several years ago when we first met. Well, there is no free lunch. One part of a plan may
Right.
be low in cost in one area, but higher in cost in another area. And so you have to look at it sort of discerning what your needs are.
Okay. You've given us so much to think about, and as our viewers may be thinking, you know, there's so many choices. How do I make these? How do I understand all of these technical aspects? When we return after this short break, we're going to talk about the SHINE program, which is a program that provides assistance to Medicare beneficiaries. So I hope that our audience will join us after this short break.
Elder abuse is always devastating, but it may not always be obvious. Isolation, coercion, and the withholding of medication are only a few of the more subtle forms of elder abuse that occur every day to thousands of our senior citizens. Please join me in the fight to end elder abuse. Our elders deserve better. Visit the website of the National Center on Elder Abuse. It's time to speak up.
During the first segment of today's show, we have been discussing the SHINE program that assists Medicare beneficiaries to make informed decisions about Medicare and other health insurance issues. Rejoining us for this segment is Jan Rauer, the volunteer SHINE trainer, and Janet Mills, our SHINE area coordinator. During this segment, we're going to talk some more about SHINE. We talked mostly about Medicare during the first segment, and then also about the volunteer aspect of that program. Janet, share with us what the SHINE program is. We've already mentioned that it's been in existence for 18 years, but tell us generally about it.
SHINE is an acronym for Serving the Health Insurance Needs of Elders. And so we assist those on Medicare, and they may be on Social Security, disability, early Medicares, or even disabled children that have Medicare. And we get a lot of training to be able to do this, right?
And Jan, what type of assistance can the SHINE counselors, which is what they are, what kind of assistance can they provide during this annual election period?
They can research and compare the plans for you. If you do not have a computer or you are unfamiliar with a computer use, a SHINE counselor can go to the Medicare website, compare the plans for you, give you that information so that you can make a wise choice with what you have for your coverage.
And this is a program, SHINE operates all year round, not just during the annual election period, although they're fast and furious right now. What other types of assistance do they provide, Janet?
All year long, basically, we do participate in health fairs. We do presentations to facilities and to the public in general. And we're always counseling all the time. It is an education advocacy program. We don't make decisions for the clients. We have to remain totally unbiased so that we're helpful in that way.
And I have seen, we have the good fortune in our St. Petersburg office to have many of the SHINE volunteers working there, and I've seen them unravel problems will take hours to help someone who has encountered a billing issue or an enrollment issue in a healthcare plan. So it's not just the selection of the plan, but helping them navigate the system throughout the year if they're running into problems.
If they are Medicare, Medicaid, we help with those issues as well because communication is a problem through the Medicaid office. So we try to fill in there, and we also help with long-term care inquiries. And we do help with providing information on getting drugs through drug manufacturer and foundation programs for people who have specific diseases or who have monetary needs for that.
And during the program, we will be running the number of our senior helpline, 1-800-96-ELDER, and that is the access point. If anyone is interested in the program, if they need assistance from a SHINE counselor, that is the telephone number to call. It's important, though, to let people know that it is a volunteer program, and we are very fortunate to have in our area 40 to 50 trained volunteers who provide assistance. So those who are calling in and asking for assistance are going to talk with one of our staff on the Elder Helpline, and they will have one of the volunteers, call them back when the volunteer can sit and speak with that individual by phone, give them the attention that they need, but it may be several days before they get back to them. We've mentioned that the counselors are volunteers, and Jan, you are a statewide trainer for this program. Share with our audience the type of training that these individuals get.
Okay, these individuals receive 3 days of basic training. It's very intense. It's usually 6 to 7 hour days, those 3 days. When they get finished, they probably know more about supplemental insurances and managed care than a lot of the people who are taking the insurance exam to become salespeople. So they get a very intense, specific training about Medicare and how it operates, about the different kinds of policies that are available, and how they operate and coincide with each other. Then they can take presentation skills training, which allows them to go out and make presentations in the community. We'll be offering a long-term care training to help folks if they're interested in assisting those who want to know about long-term care insurance and how to cover their long-term care needs for the future. We have a lot of different kinds of education packages that are available to folks who think that this is a volunteer opportunity that they would like to take advantage of.
And I need to mention that the services are free for those who call in, and they are unbiased. There is no incentive for the counselors to recommend one program over another. They are doing this as a volunteer for all good purpose. And it is funded by the Center for Medicare and Medicaid Services. It is a national program, and we are very fortunate to have it through our Florida Department of Elder Affairs and then actually being implemented at the in Pasco and Pinellas County through the Area Agency on Aging. And Janet, we are so very fortunate to have you as the coordinator of our volunteers in both counties. This is a good opportunity to mention that there is always a need for volunteers, people who feel that this is of interest to them. They can call that telephone number, the 1-800-96-ELDER, and let us know that they're interested in volunteering. What type of people are you looking for that fit well to this commitment?
Well, I always say that you have to really have a love of helping people. You have to be a lifelong learner, because we learn a lot. We learn every day. And you also have to have the patience of Job, because you are helping people that have not been given the information that they need to make their decisions.
And what do your volunteers, or you as a volunteer, what do you find most rewarding about being a volunteer in the SHINE program?
I think that the fact that you realize that you've helped somebody that has virtually been failed in the system in some other ways, and that feels really good at the end of the day.
Jan, do you have something to add to that? You have been a long-term volunteer at many levels in the SHINE program, helping many volunteers to learn.
I think the joy I get is when I'm standing in front of a classroom full of students, and you see the light bulb go on, and they get it, and you say, that person's going to be a good counselor because they get it. And it's very rewarding. It's a great feeling.
I've seen from the core volunteers that we have in the St. Petersburg office, there's somewhat an intellectual enjoyment of getting together as a group and trying to sort out resolutions to complicated problems. The volunteers are not left on their own. It is a continual training process, a continual team approach. Janet, I've seen you mentor so many volunteers
Right, after they take their 3-day training, then we mentor them, and there are several mentors that do this, and we never leave them on their own until they're comfortable. Absolutely.
So if there is someone out there who sounds like this is piquing their interest, they can call us. The next classes for volunteers will probably not run until the beginning of the year, but we can take information now, and there's a process that one goes through.
In general, we run 3 or 4 classes a year, and so there will be, time choices, and so please call. We're always in need of volunteers. Most of us are older, so people move away to be with their family, or people become too elderly to do this, and so we have a lot of long-term volunteers, but we also have voids that happen because of illness and people moving. So please join us.
And the commitment that you are looking for from a volunteer, is there a number of hours that a volunteer should anticipate that they will be asked to provide assistance?
Yes, DOEA has said that a volunteer will give at least 16 hours a month, and it's a 2-year commitment.
Going back to talking about Medicare, were there other changes that we are going to see this year in the Medicare program?
Not that have become available as of yet, but we all know because of the recent announcement of the cost of living increase and the Social Security checks, it's safe to assume, I think, that there will be an increase in the Part B premium, so people should be prepared to see that when it occurs. They have not yet announced those premiums, so I think they were waiting for the cost of living to come out, and then they'll be making their announcement, I would think, shortly. The only thing new was, again, was being able to choose a 5-star plan anytime during 2012. The supplement plans in last June, did come out with some additional benefits that people may not be aware of, in that they do, if you bought your plan after June 1st, 2010, you have coverage for hospice benefits, and you have coverage. Most of the preventive services now are at 100% coverage. They're going to be offering a couple of new services under preventive care, which will be some alcohol and drug abuse sessions, evaluations and sessions, and some depression sessions.
Okay,
so this is
expanding
coming.
coverage.
Yes,
very good
they
to
will
hear.
be covered.
Very good to hear. And I want to leave our viewers with the thought process that as you are reviewing your plans, there is assistance available. I think it's very important. Some of the tips that you, Jan, mentioned about things to consider. If someone is calling our senior helpline, to have a counselor call them back. Before you call, before you have that discussion, please take some time to consider, who are the doctors that you want to stay with, make a list of your prescription drugs, so that will help to facilitate the assistance that the Shine counselors are able to provide them. I thank you both so much for being here today, and more importantly, for the valuable work that you provide for our seniors and those who are disabled that are receiving Medicare in our community. And I hope our viewers have found this information to be of interest and to be of help to them through this annual election period.
Hi, I'm William Mapother. I play Ethan Rahm on the TV show Lost. Let me tell you about a truly lost population. Every single day, thousands of our elderly citizens are subjected to abuse, emotional, financial, physical. Worse, the majority of people who commit these acts are those closest to the victim. Please join me in the fight to end elder abuse. It's time to speak up. Our elders deserve better.